Hi everyone and welcome. My name is Dr. Melek Aslan and I work as the Health Director of Fatih in Istanbul for Ministry of Health. I will be moderating today's session. This webinar is one of the several events organized by the Society for Public Health Thinking and Innovation as part of European Public Health Week 2025. To briefly introduce SADI, it's an independent professional association made up of public health researchers and professionals based in Turkey. Today's daily theme is this webinar will explore the addiction prevention efforts of the Green Crescent, Yesilay. Dr. Mehmet Güllüoğlu will present key strategies, field practices, and multisectoral collaborations aimed at strengthening both individual and community resilience. The session will highlight how Yesilay model contributes to public health through education, early intervention, and support systems. And I would like to briefly share Dr. Güllüoğlu's biography. He is the Vice President of Green Crescent, Yesilay. He's a medical doctor with a PhD in public health. Dr. Güllüoğlu previously served as Turkey's ambassador at Dar es Salaam and held leadership roles at Ministry of Health, Turkish Red Crescent, and the Disaster and Emergency Management Authority, which is called AFAD. He has also taken part in numerous humanitarian and aid missions as a volunteer doctor with various NGOs worldwide. The session is scheduled for 1 hour, and I would like to remind you that the session is being recorded. We will answer questions at the end of the presentation. So please feel free to write your comments in the chat or question and answer section. Dr. Güllüoğlu, the floor is yours, and welcome. Go ahead, please.
Thank you very much, and good afternoon to everybody. Let me also open my presentation. I hope you can see. Can you see?
Yes, we can see you.
Okay. In this presentation, I will be trying to share with you the addiction prevention resilience and then the activities of the Yesilay. Briefly, let me give you information about the Yesilay. Yesilay is an NGO, is an association, a non-profit organization established in 1920. I mean, we are talking about a 105 years old organization. For decades, we were dealing with the prevention activities, and in last 15 years, we are also dealing with the treatment, therapeutic and rehabilitation activities for the addicted people. And also, we are the main advocacy organization against 5 types of the addictions. We are dealing with the tobacco addiction, alcohol, substance, gambling, and the internet-based or technology addictions we are trying to manage. In non-communicable diseases and also in the public health, we know that these kind of addictions are one of the important reason for the mortality and morbidity. And we know that treatment is the difficult part, but the rehabilitation, the prevention is the main part. Although prevention policies may appear costly in the short term, in the longer term, they deliver significantly greater benefits to the healthcare system, to the society, to the individuals in the long run. According to the investment case report prepared by WHO Regional Office for Europe and the Ministry of Health of Turkey regarding the prevention and control of NSD disease in Turkey, non-communicable disease in Turkey, there's a huge benefit of the prevention activities in these kind of addictions. But also, although we all know that prevention activity is the really important, I mean, cost saving, saving the lives before they get any diseases, it shows that the cost of prevention is significantly lower than the cost of treatment and disease management. And it is a more economical, sustainable approach. But asking for sponsorship, asking for donation for the prevention is difficult because you are asking sponsorship for a healthy group of people. You are asking sponsorship for an event. This is not that much superheroic activity for treating a cancer patient. This is not an approach or a project for malaria cases. Unfortunately, in the world, it becomes a paradox, and we call it prevention paradox. But prevention policies are not only the most beneficial solution for longer term health, but also it brings a lot of advantages for the economical perspective. But telling it, expressing it to the community for the society for sponsorship, it is a difficult approach. Education and educators, I mean the teachers, are main and crucial partners for prevention against addictions. It is stated that medical treatment accounts for only 10% of the effectiveness in combating addictions. Medical treatment is only 10% of effectiveness in combating addictions. Unfortunately, 90% of people cannot be treated or couldn't be treated in addictions. Only 10% of them. Psychological component, which contributes 15% to treatment effectiveness, is conducted by professional psychologists. It is also very expensive and longer term and costly approach. However, the most significant part of addiction prevention lies in these social interventions and preventive measures, which can be 75% of the impact. That's why we should be focusing on the social interventions and preventive measures through education. Education are very important because the main impact against addictions are on that side. How we can do it? How education can work against addictions? Number one, I mean, it is one of the very important areas, raising awareness. Educators help students recognize the risk of addiction and become more informed on the subject. You know that, I mean, using tobacco, cigarette smoking, or even alcohol, consuming alcohol, mostly presented to the communities, mostly presented to the youth as something cool. But when we can raise awareness before youth accept it as something cool, that this is something dangerous for the life, it is dangerous for the economy, it is dangerous for the social performance, then we can reach our target. The second thing, behavioral change. Education supports students in developing healthy lifestyle habits, thereby reducing the risk of addiction is an important area. In our trainings, I will be sharing also, we try to teach kids, we try to reach young generation how to say no, where to say no, when to say no. Because if they don't have that skill, if we don't give them to have the control of the behaviors, then the addictions are increasing. But if they know when to say, how to say no, it becomes an important skill for them. And another way to make this difference is early intervention. They identify early signs of addiction in students and provide appropriate guidance and referrals. Most of the addictions start at the school age. It can be secondary school age, it can be high school age. If the teachers, if the educators, if the directors of the principals of the schools can understand it, can identify the early signs of addiction, then it is like catching a cancer in early stage, then the treatment and the control can be easier. That's why in our case, against addictions, if the principals, if the teachers can identify the early signs of addiction, and then they can react, then they can respond, and we can stop addiction in an early stage. For these activities, we have three types of the program, education program. Number one is response to the addictions in the school. This is a user intervention approach. We give these trainings in the school, and if there is any addiction at an early age we can catch, then we will be making our intervention when there's a substance user at this level. Before that, we try to develop skill development. One of them is how to say no, where to say no, the skill to say no development. And as a broader approach, we are trying to raise awareness through Turkey response to addiction education program. Every year, we are trying to reach 10 million school students in different levels through this program. This program, this coverage is the Turkey's most covered and the most easy to approach addiction prevention program. I just want to share some key highlights again. This one. These programs are developed by the Turkish Green Crescent to address addiction threats in all age groups. For different age groups, the program is aiming different targets. It combines school-based, family-based, and community-level prevention. It covers addiction including tobacco, alcohol, drugs, gambling, and technology. And it reaches children and youth with modern evidence-based educational tools. We are working with a lot of professors from psychology, sociology, from psychiatry, from different social sciences. Materials are developed with scientific experts and adapted to all age levels. Delivered both in person and online, in face-to-face trainings and also in online trainings, with modern and interactive content. And this is Turkey's first nationwide prevention program with this level of scale and scope. As I said, we are reaching 10 million kids every year. In this program, Turkey Addiction Prevention Education Program, we developed this program with different stakeholders. Of course, one of the main stakeholders is the Ministry of National Education and other government organizations, other ministries, public organizations, NGOs, private sector, and universities are our partners in this program. You cannot reach, 10 million people with only yourself. For this program, first of all, we train our trainers. Until now, more than 44,000 trainers and implementers get trained. In this photo, you see trainers. They are acting. They are using the same scenario which they will teach to the kids. Through this program, every year we reach 10 million students and 3 million adults annually. We also developed a lot of books for this one. These are some of them for this one. What is tobacco addiction, technology addiction, healthy life, gambling addiction, substance addiction, alcohol addiction. There are a lot of academic textbooks, educators' guidebooks, student workbook, presentations. I will be sharing children's songs, 3D or 2D animations, presentations, picture books. A lot of materials are created, are designed by our team. And also we have some games, some board games. Some of them are for preschool, for school age, 8+, 9+, 14+. Games are for, these are other materials for addiction prevention trainings. And also we have 3D animation and 2D animation movies telling about addiction and, as I said, addiction prevention and other materials. We have different board games, card games, sticker activity books, art activity books, life skill journal. These are all supported documents, supported publications designed and developed with our team. As I said, this kind of big scale program cannot be realized by only one organization. Ministry of National Education is one of the main partners because students are our target group. Second one is Ministry of Family and Social Services Ministry, Ministry of Youth and Sport, Ministry of Health, Ministry of National Defense, Religious Affairs Organization, Turkish Red Crescent, İşkur is the employment organization from the government, Istanbul Metropole Municipality, and the Federation, Green Crescent from different countries are our main partners in this program, TBM. Ministry of Family and Social Services also, we are working closely through them, and through them, our cooperation started in 2017. Until now, we reach more than 1 million people, and we have totally 433 trainers, and through them, we reach to the people. Through Ministry of National Defense, we reach more than 140,000 people, because in Turkey there are still hundreds of thousands of people, hundreds of thousands of the young men goes to the obligatory military activity. in different schedule, in different terms, it is then chance for us to reach them. Ministry of Youth and Sports, of course, another group for us, because they have a lot of activities for the youth through different projects. Through them and through trainers, we are reaching the young generation. Diyanet is then another group for us, another organization which is very important for us. We trained them, we reached trainer of trainers, and then through them we reached to their target group, their staff, and through them close to 600,000 seminars and khutbahs we are reaching people. And every year we are trying to reach, after Juma praise, Friday praise, we are reaching people through them. Ministry of Justice, because in their system, there are a lot of people, including the prisons, including the education centers. We are trying to people also. Another one, Ministry of Interior Affairs, Ministry of Home Affairs, it's an important partner for us because police and gendarme are under their authority, and they are also reaching people. And for advocacy, for civil society organizations, they are important partner for us. Through them, we are reaching people with the Ministry of Interior Affairs program. And other collaborations, of course, Istanbul Metropole Municipality, Muhtars, we call it Muhtar. In different countries, there is the same system. The neighborhood heads, this is the first elected and the smallest elected body in our election system. Turkish Employment Agency, we are also giving training them, and through them we are reaching people. Turkish Red Crescent and different NGOs, we are reaching through them. We also have a club activity in the universities and also in the high schools. We are now increasing our clubs. Through these clubs, we are trying to go beyond than just a training, just a presentation, to reach them through different activities. It can be sports activities, it can be an art activities, and through these kind of activities, we are trying to reach younger generations, because addiction sectors, let's say the tobacco sector or alcohol sector, are very aggressive. They are trying to reach, they are reaching young generation at very early age. That's why we are trying to increase our activities, and we are trying to defend a healthy lifestyle at an early stage. Because of these activities, we started a new campaign. It's called Independence Movement, Mobilization for the Independence. We can call it like this. It aims to contribute to the prevention of addiction by raising awareness among different segments of society and implementing neighborhood-based preventive and family support programs. While starting this project, we were aiming that you can find, for example, tobacco or alcohol in every neighborhood. I mean, even in small markets, even in small shops, you can buy tobacco. Then why we don't defend, against addictions? Why don't we defend healthy lifestyle in even same neighborhood? That's why we started this mobilization of independence campaign. We are trying to make advocacy. We are trying to inform people about our rehabilitation capacity, and we want to realize prevention. And our slogan is Turkey as Yesilay, and we want to involve a lot of volunteers and a lot of people into this campaign. We want to reach through our volunteers, through people who defend healthy lifestyle, to every corner of the country. In this program, we are trying to reach muhtars, we are trying to reach imams, healthcare professionals. It can be a pharmacist, it can be a doctor, it can be a nurse. Of course, education professionals, the doctors, the teachers are already our very natural and important and strong partners. Family counselors and shops, even small shops. It can be a tailor, it can be a market staff who supports healthy lifestyle. We are planning to reach them for this prevention and sustainable prevention. Why we need this? As I said, tobacco, alcohol, or substance industries are very aggressive. They are entering to each corner of the countries. That's why there's a big spread of the addiction in society. We must do something better and something broader. Strengthening the family structure is needed because we know that the weak family links is one of the risk factors for the addictions. If we can strengthen the family structure, if we can strengthen the family bonds, family links inside the family, then it will be an important power against addictions. We must protect our youth and our kids. I mean, protecting the next generation is protecting the country. That's why we call it independence, like an independence of a country. If we can have independent young generation, it will be future of the independence of our country. As I said, we know that the neighborhood is very important. Approaching local resources are very important. That's why we want to create an impact at the neighborhood and local level. We want to give this agenda for the average people in the local level, because if they can be defender of the healthy lifestyle, it will create a big impact. We must increase acting the social unity, because this kind of the activities cannot be handled by only one organization. Only as the Yesilay we cannot manage it. Only as the Minister of Health cannot be manageable. But if we can have social unity against addictions, I think the impact will be bigger. Addictions are unfortunately affecting negatively the social welfare. They are decreasing the security and even security perception. They are affecting negatively the health of the individuals and the health of the communities. And they are affecting negatively the economy in the country level and also in the individual level. That's why enhancing social welfare also needs to fight against addictions. We need to approach a sustainable approach. That's why building a sustainable solution, we need a bigger community approach from local level to the national level, even international level. If we want to build a sustainable solution, that's why we need this kind of programs. And of course, as a Green Crescent, we want to show our visibility. We want to increase our visibility. We want to increase our impact, because we are symbolizing the healthy lifestyle. Whatever we do, we are doing for the next generation. Whatever we do is we are doing for the community. Our organization is a non-profit organization. We are trying to continue the heritage of the 105 years of the organization. That's why we need this kind of program, which we call Mobilization of Independence, Bağımsızlık Seferberliği. It must be like a big mobilization, like in a war. To tell the truth, addictions are like a pandemic covering all over the world. In different countries, we see different addictions. Even in Turkey, we are still resisting against a lot of addictions, a lot of different kinds of the addictions. But even in the Turkey and even all over the world, addictions are increasing. We should do something better. We should do something more, and we should do something in more effective way. That's why we believe that we need this kind of activities. We need this kind of campaigns, and we need more partnership in the good causes, in the better causes. Thank you very much. I mean, what I want to share is the addiction prevention activities as the Yesilay case. As I said, we are reaching currently, and we are trying to reach more millions of people. Even in Turkey, there are a lot of Unfortunately, just a second. Unfortunately, addictions are increasing. Tobacco addiction, alcohol addiction, substance addictions are increasing, unfortunately. We are trying to find different ways, but it's a very long-term problem. I mean, to find solution, to implement it, to sustain it, it's not an easy thing. What we know that all over the world, as I said already in the first slides of my presentation, treatment of the addiction as a disease is very difficult, very costly, highly costly. But prevention is the, I think, better way. But even prevention is not easy. We should spend a lot of money. We should have a good social organizations, good social networks we need. But we should continue it if we want to save our next generation, if we want to save the economy of the country, health of the country. And as the public health approach, I think you know that for NSD, there is 4 things always mentioned, that tobacco, alcohol, sedentary life, and better nutrition. Even just 50% of these 4 measures is also very close to about addictions. That's why I think addiction should be always one of the main agenda on the public health organizations, on the public health topics. Thanks a lot for us to giving chance to discuss about prevention activities against addictions.
Thank you very much, Dr. Güllüoğlu, for your presentation. And for the other attendees, I would like to now share the questions, if there is any, from our participants. From now on, please feel free to write your questions and comments in the question answer section. If any, we will wait for a few minutes in order for your questions to come. And I will always have big support for Yesilay in my life too. So thank you for this generous presentation. It was very informative for our future and also for the past, because past means what they have done in 100+ years, and what will happen in upcoming years is very important, because we're looking to the future and feeding ourselves from our past. So it's very important.
Thanks a lot, Dr. Melek. While waiting, I mean, I can say a few things more. In fact, this is really a marathon. Because as you said, we are working for 100 years, 100+ years, but our country is a big country. I mean, 85 million population is not small population. And if you think that we have more than 30 million young generation, even just for them, we should do a lot of activities, we should do a lot of campaigns. Plus, more adult generation. It means just for Turkey, I mean, there must be a big challenge. We must be trying to find different ways against addictions. I mean, of course, mainly prevention, but also for the treatment, for the rehabilitation. This is not an easy task. We are very much aware of it, but we should continue. We should do our best against addictions. Otherwise, those sectors, tobacco sector, alcohol sector, as I said, they are very aggressive. They are very good in communication. They are very good in networking. They are very good in the logistics. As I said, you can find tobacco products in every street, in every corner of the country. Then it also triggers us. It also encourages us that no, we are on the right side of the on the history. We are on the right side of the health. We are trying to save the health of the people. That's why we must increase our network. We must increase our defenders, the number of defenders and their activities. That's why we started this campaign. I hope we can be successful.
And you, as mentioned, you said 30 million young people, young teenage, actually, upcoming numbers. That means 30 million families in the future. So it's not a small number, actually. Even for the whole world, if you look at it, if you try to multiply that number, you means that you minima aiming at 100 and something thousand, just minima, just for in these days. So just the first question. But what can you say about the roles of the public health professionals in those efforts?
Thank you very much. This is a very important question because although we are trying to create national programs and national campaigns, we know that in each local, it can be a town, it can be a city, it can be one neighborhood. We can do something, some programs locally, because different cities has different problems and different cultural approach. We can create different communication methods. That's why for a public health expert, it can be one of the, like in your position, a director for the town, or it can be one of the health director of a city. But each town has different sociology. Each town has different group of people according to their needs and according to their maybe communication approach. The public health experts can create programs. Of course, one by one relation and creating local campaigns are very effective, what we know. Well, in some countries, alcohol, in some cities, let's say that alcohol can be more covering people for addictions, but in some cities, the tobacco is the main topic for the addiction. That's why from the public health perspective, from an expert from a public health perspective, first of all, defining which addictions are more visible or more covering the addicts in there, and then creating programs through our textbooks, through different guidelines, and directing them to the Yesilay, our counseling services, or through Ministry of Health, getting in touch with them. What we know that although we are one of the old organization, more than 105 years old organization, sometimes people are embarrassed, they are ashamed to call us, or they don't know the details of what kind of services we are giving. That's why even finding the risk groups and reaching them, directing them to reach us, directing them or helping them to reach Ministry of Health can be one of the very important activities. Of course, the prevention, again, for risky groups, if they can produce, if they can create programs which support prevention, it can be some of the sport activity, it can be some of the art activity. Today, in one of the morning session in the European Public Health Week event in the Medipol University, one of the professors asked one of the very important questions for me. He asked that what is the health professional effect on the health of the community? I mean, of course, as the health professionals, we feel that we are very important, but what is the effect of it? And another professor's reply was important, but he said that according to WHO reports, it is not more than 50%. I mean, it is limited with the 50%. That's why finding partners, it can be education partners, it can be sport, culture, it can be very different partners, it can be private sector, but giving opportunity or showing different ways for the young generation, showing different environments for the different groups of people are one of the very important areas. That's why for public health experts, creating and showing different ways rather than addiction for the young generation, I think can be one of very important thing what they can do.
Thank you for that. There's no more questions, but I have one last question. Through Yesilay, can people who wants to adapt themselves for the prevention activities, can they get help in other languages as well? Because in Turkey, so many people from other countries are living as well. So as far as I know, there are some few information about English psychologists in your centers, but can I learn the answer from you firsthand?
Of course, in fact, by this way, I should say two more things. One of them, Yesilay is also the founder of the International Green Crescent Federation. Now, currently, there is 65 Green Crescent of organizations in different countries from Asia, from Latin America, from Europe, from Africa, are also working in the addiction activities. We are trying to we are trying to come together in a periodically. In fact, 2 weeks ago, even this presentation from one of my colleague in the capacity building for the Green Crescent, for the International Green Crescents. That's why we are sharing our knowledge in different languages, and we are increasing the documents in different languages. This is number one. Number two, by this way, I also want to share and I want to invite the audience to become volunteer, not only for Turkish Green Crescent, but if there is anybody from different countries, please, these kind of organizations who are working against addictions, we need volunteers, because as I said, we cannot fight by ourselves. We need people, we need volunteers, we need multidisciplinary, multi-stakeholder approach to fight against addictions. That's why please don't only check for documentation, please become our volunteer and contribute to our activities.
I would like to sincerely thank our speaker, Dr. Güllüoğlu, for the contribution, and for all our attendees for their precious times as well. You can also follow our upcoming events on HADI from the website and IPA website as well. And thank you one more time and have a good evening.
Thank you very much, Dr. Melek, and bye-bye.